Welcome to the Cystic Fibrosis Foundation CF Education Day, partnering when thinking about lung transplantation. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast is hosted by the Johns Hopkins Cystic Fibrosis Center and supported through an unrestricted educational grant from Genentech. It is a part of the Partnering for Care webcast series that focuses on the different roles the healthcare professionals in a CF center play as members of the CF care team. This is all focused on so you or your child with CF can thrive. Anyone with CF or who cares for somebody with cystic fibrosis knows that it takes a team effort. This includes the person with CF, their family, their friends, and the healthcare professionals at the center. Partnership is when a person or persons take part in an activity with others. In this case, the activity is cystic fibrosis care. Partnering with your healthcare professional is important in order to help you or your child thrive. It will help you or your child learn how to live life with cystic fibrosis instead of living life for cystic fibrosis. This presentation will focus on how to partner with your CF care team members when thinking about lung transplantation. Questions from this segment came from you, the community. Questions not related to this topic or that ask for medical advice will not be asked or answered. If you have additional questions, I encourage you to talk to members of your CF care team. Also, you can contact the Cystic Fibrosis Foundation at 800-FIGHT-CF or info@cff.org. Joining me is Dr. Peter Moygazel, who is the Center Director at Johns Hopkins CF Center and the Director of the Pediatric Lung Transplantation Program, and Dr. Michael Boyle, who is the Director of the CF Adult Program at Johns Hopkins, both in Baltimore, Maryland. Welcome, Peter and Mike.
Thank you, Leslie.
Thank you, Leslie.
The first question is, and a very common question that I get, is lung transplantation a cure for cystic fibrosis?
Unfortunately not. I think that we've all had this question. We would love if it is. I think we have to be realistic about lung transplantation, though. Lung transplantation is something to fall back on when your own lungs can't go any further. Unfortunately, it's not a cure. The rest of you still have cystic fibrosis, and that there are some limitations. We're going to talk some about those. But I will say that it's something that when there's not other good options can be a wonderful thing to improve quality of life and length of life.
So should everyone with cystic fibrosis get a lung transplant?
Well, lung transplantation is not for everyone. The goal for us in caring for patients with cystic fibrosis is to have them stay as healthy for as long as possible. And for some people, a lung transplant is a next step when their lungs begin to fail. However, lung transplantation is not a cure, as Mike said, and it is something that requires a great deal of care. You're trading one set of problems for another set of problems, so that it requires lifelong medication to prevent rejection and medication that makes infections more likely. So it is a balance of a lot of different things.
So like you said, it's truly changing one disease for another condition, and it sounds like it's just as complicated and complex as managing CF.
It can be in many ways. What you need to do to take care of yourself when you have a lung transplant is different, and you may not need to do the same therapies you do when you have CF, but it does require lifelong care, and a great amount of detail goes into that care to stay healthy.
So what do people, or what should people know about transplantation when they're thinking about it?
So I think we talked about being realistic. Since it's not a cure, but a wonderful thing to fall back on, we sort of need to know some of the statistics. So we've generally quoted that the typical survival after transplant is about 5 years, so about 50% of individuals survive 5 years. Now that's recently improved, probably with double lung transplantation. Up to six years is this sort of the expectation now, with the range though being from individuals who never make it through transplant, thankfully very rare, to individuals who can live 10 or 15 years. So part of it's being realistic. Part of it also is that timing is essential. It's easy to think the first time or the couple of times that you're sick, that you're on IVs, that you think, if I just had a lung transplant, this could all go away. There's been a couple of very good studies now which have shown that if you get lung transplant too early, you're actually shortening your life. So transplant is something that you think about when your own lungs are failing. And so this is something that you work very closely with your physicians about in terms of timing. So the ideal thing is to think about transplant, be prepared when your lungs are getting more severe, and that when you actually are getting to be real sick, that's the time to do it, but you don't want to wait so long that you're too ill to be able to do well.
So this question came in registration. At what point do you consider, you talk about when the lungs are failing, what do you look at that makes you decide, we need to start having this conversation about transplantation for this person?
Well, it's really a combination. It's a combination of symptoms and of lung function. And you don't want to do a transplant too early. So I start to talk to patients about lung transplant when they really are unable to do the things they want to do. When they're unable because of shortness of breath or difficulty breathing, that they can't do the things that they need to do, that they need to wear oxygen perhaps all the time. The other thing that factors into this is how often they're getting sick. Do they need to be in the hospital frequently? Does that frequency of being in the hospital shorter and shorter, so they're getting sick more often? And that combined to what the numbers are in their lung function. And it's not one absolute number that you say if you're FEV1, your forced expiratory volume in the first second. That's the lung function value we usually use to determine the need for transplant. It's not one number that you can say this is the time when you need a transplant, but it's the combination of what that value is, how quickly your lung function may have declined, and the other symptoms that you're having that determine when you should be referred.
Oh, you're going to say something, Mike?
No.
Okay. Well, I actually had this interesting conversation with a grandfather recently who called and wanted to know about his grandson who was early teens. And the family's not paying attention to lung transplantation, and he was trying to find out information. So the question really is, what can extended family do to help find out, and when should they find out, or are they helpful in finding out about lung transplantations?
I think part of it is being educated. The basics that we're talking about right now can be very helpful in realizing it's not a cure, realizing that there continues to be problems after lung transplant. Sometimes individuals may need encouragement to talk honestly with their physician about their symptoms, though. So there's a lot of fear of talking about that because of fear about transplant. So I would say that family can be very supportive in gaining some of that information, and then helping the individual with CF, particularly if they're younger, to be honest about how they're feeling and what's going on.
So there again, it's open communication with the members of their CF team. What's going on, symptoms, and how they truly feel. So you mentioned, to let, is it better, I'm trying to reframe this question that we got in registration, is it better for the person with CF to get on a lung transplant list early or to wait as long as possible? You've kind of talked about a little bit, is it better to be proactive and get listed early or to wait?
I would say somewhere in between. Right, so everybody asks when's the right time to think about lung transplant. Peter was already talking about there's certain things, symptoms. Usually it's lung function, FEV1, that's maybe down in the 20 or 30% of predicted range. But there is, in the past, there was an advantage to being listed very early because there was a waiting list that depended on time. So once you got on the list, you just had to get in line. In 2005, the lung allocation score changed that so that individuals are now ranked by how sick they are. So this takes some of the pressure off. So what I would say is talk about it early. Talk about it with your physician so you're educated, so you know. But the idea of getting transplanted or listed really early probably doesn't make a lot of sense right now. On the other hand, you don't want to wait so long that you're too ill to do well, and that's something that your physician can help you work through.
Okay. Are lung transplants an option for someone with Burkholderia-Cepacia? And if so, what do they need to know about?
Well, lung transplantation for Burkholderia-Cepacia is more difficult than for the people without it. There are different types of Burkholderia-Cepacia, and particularly Burkholderia-Cenocepacia is one that is associated with poorer outcomes. And at this point, there are very few centers that are transplanting patients with Burkholderia cenosaphacia, and the reason, again, is because they have worse outcomes. I would encourage people to talk to their physician and find out what options may be available for them.
So this question came in just now. This person is 50 years old, and they want to know if transplantation has less positive outcomes at someone at their age or not. So let me make it a little bit larger and go, what factor, or is there any factor, that age has in transplantation outcomes?
So it's interesting. If you look at the outcomes based on age, it's actually, there's not as much difference as you would think based on age. There are some certain guidelines. Our program will not transplant somebody over the age of 65, so there's an upper limit. However, if you look at how individuals who are age 50, age 40 do versus somebody who's 20, there's probably not a big difference. One thing to know is that individuals with cystic fibrosis do as well or better than any other disease which leads to transplant. So I would say that the most important thing is not your age. We've had some very successful transplants at, what was it, 50, 55? 50. If you need it, there's no problem at that age.
So tell me about living donors. I know they used to do them. Somebody actually sent in a question. Are they still doing them? What's the potential for a living donor? Number one, what is a living donor transplant?
So living donor transplant had gained a lot of interest, or a lot of interest had developed in the 1990s and into 2000 because of the shortage of organs for donation. Living-related transplant, or living transplant, is taking a part of a lung from a live donor, oftentimes a parent, and transplanting that to replace one lung of a child with cystic fibrosis or a small adult. Because you need to transplant both lungs, you need two donors, one to transplant a lobe into each lung. And the idea behind this is it would alleviate the shortage because you could plan for the transplant. And if they were related, the donor and the recipient, then there might be better outcomes. It turns out that the outcomes are about the same as doing standard transplantation. And as Mike said, with the changes in the allocation system, donor organs became more available. So the pressure to have additional organs to use was lessened. So I think at this point there's very few centers that are still doing living donor transplantation. And at this point, using standard donors is probably a more effective way to perform transplant.
So you recommend people how do people find out whether or not a transplant center is doing living lobe donors?
Very few, if any, are.
So
they could talk to their physician.
Or talk to the transplant centers?
They could ask the transplant center directly. If there is a transplant center that their physician recommends, then they could call the transplant center directly to find out the answer to that.
So last question. What is the goal for someone thinking about a lung transplant?
I think the goal is to keep in mind that transplant hopefully will provide some length of life and some quality of life, but it's only in the setting where you're smart about when to do it. Because we've talked about being realistic. We're talking about adding maybe another 5 or 10 years. So you don't want to do that too early. So it's something that you say, work as hard as you can right now with the medicines that we have, all the options that we have to avoid transplant. When it's not avoidable anymore, then it's a nice backup plan to have.
So I want to thank you, Peter, and thank you, Mike, for answering these questions about lung transplantation. Remember, being a full member of your CF care team is important in order to help you or your child with cystic fibrosis thrive and learn how to fit CF care into your life versus your life into CF care. I want to encourage you to learn more by talking with the different members of your CF care team. The CF Foundation website also has information related to transplants under the treatment section. You can read the frequently asked questions about lung transplantation, and in the CF Care Guidelines section, there is a guidelines for lung transplantation. You can also learn more by searching PubMed, which is the medical journals online. It's a medical and scientific journal database that's kept by the National Library of Medicine at the National Institute of Health. Also, transplantliving.org has information related to transplant before, during, and after, and some good tips. The United Network for Organ Sharing is the organization that manages the transplant system and is involved in what Mike was talking about, that is the lung allocation system. The NIH has medlineplus.gov, which has information and a lot of resources related to transplantation. NTAF is an organization that helps families address financial issues related to transplantation. The Children's Organ Transplant Association was founded to help families pay transplant-related costs for patients aged 21 years and younger. Organdonor.gov is another location of some great information about transplantation and ways you can get involved. And last, you can't do a transplant unless somebody is willing to donate their organs at the appropriate time. So shareyourlife.org helps others know what they need to do in order to designate that their organs could be transplanted. This presentation is a part of the Partnering for Care webcast series available on the CF Foundation's website. This series includes such topics as partnering with your child for CF, as an adult with CF, during transition, what it means to be a CF Foundation accredited care center, how to work with your CF nurse, your dietitians, your respiratory or physical therapist, your social worker or psychologist, so you or your child with CF can thrive. You can also watch an archived webcast on the CF Foundation website and learn about research, nutrition, lung health and disease, germs, and more. This concludes the CF Foundation's Education Day, Partnering for Care, Thinking About Lung Transplantation. I would like to thank you for watching and submitting your questions, Peter and Mike for answering those questions, Rick Vasta and the technical crew, Emily Ann Powell, Melissa Chin, and the CF Foundation for making this possible, and Genentech for their unrestricted educational grant. Thank you.